My name is Dr. Eric Pifel. I am an orthopedic surgeon. I have a model of the hip in my hand here, and this is a left hip, sort of mimicking my left hip if you were looking at me in my office. And what I have here is the femur or thigh bone inside the socket joint. Day-to-day life, we walk sort of like this. And when we have hip impingement, sometimes we'll have excess bone on the socket of the ball and socket joint, excess bone on the ball. And when those come together, we twist up and it will pinch that labrum or deepening cartilage that you can see as this rubberized tissue here and create pain. When a patient goes under arthroscopy of the hip, the biggest thing that we need to do is get more space for the surgeon. So in order to get more space so we don't create more injury, we need to distract the hip. We pull the hip like this to allow a little bit of space, approximately 10 to 12 millimeters. So it's a distraction to allow me to do the surgery safely without creating further problems. Small poke holes are used to access a joint without making big incisions. The small poke holes allows enough pain control to go home that day. So that'll give you a good idea of how most people respond to this. So even though we're pulling the hip apart by doing a controlled dislocation, the pain is not typically much more than a knee surgery or shoulder surgery. The second step is doing some rehab, usually on your own for the first week or so, with a physical therapist for the next 2 to 4 months, depending on what part of hip arthroscopy is performed on you. Most people are on crutches somewhere between 2 to 6 weeks, depending on if we have to take away bone spurs or repair cartilage. And after that, therapy gradually increases activity to where most people are able to run, jump, twist, and turn somewhere between 4 to 6 months later, depending on the pathology they had.